Good afternoon. This is Dr. Vikram Singh. I'm a nephrologist at Suvik Hospital in Dehradun, Uttarakhand. This interaction or the message is in relation to World Kidney Day, which is generally celebrated on second Thursday of every March. And this time it was on 9th of March. As we all know that in addition to all other diseases, both communicable as well as non-communicable, kidney disease, the number of patients have been increasing very rapidly, especially those related to diabetes and hypertension. And many of our patients are developing kidney disease and later on kidney failure, also related to kidney stones and diseases like nephritis. Some of them may actually have inherited diseases like autosomal dominant polycystic kidney disease. One major problem with most of the kidney diseases is that the symptoms actually come very late. So all those people who are at high risk need to get them investigated regularly. Maybe diabetics should get their routine urine test as well as blood test done every 6 months or at least once in a year. And similarly, it is true for patients having hypertension. Also, they need to keep their blood pressure as well as sugar under good control so that they do not affect the kidneys. Once the kidney disease is there and especially the kidney failure is advanced and someone is advised to undergo dialysis or maybe a transplantation, transplantation is obviously a better form of treatment in such situations. But those who cannot go or do not have a donor in the family, the dialysis is a reasonably good option. A reasonably good quality of life can be led while being on dialysis, provided you start it in time, continue it in adequate doses, that is 3 times in a week. In addition to regular management of kidney disease, other comorbidities also need to be looked into, especially good control of blood pressure, diabetes, cholesterol. One need to quit smoking completely as well as control your weight regularly so that they are within the acceptable range of body mass index. Also, regular exercise is extremely important because that will help you maintain the muscle strength and you are able to perform your day-to-day activities regularly. We actually need to prepare in advance. That was the theme of this WKD or the World Kidney Day this time, that prepare well in advance, especially those who are at higher risk, so that the chances of emergencies become very less. Once the person gets into kidney failure, they can be taken on dialysis or transplantation very well in time. Especially the AV fistula need to be made very well in time. I also wish to mention here that all kidney diseases are not irreversible or permanent. There are many kidney failures which are acute in nature. If detected in time, can be managed and completely treated, especially those who get kidney failure because of dehydration, diarrhea, vomiting, infections, and certain drugs. While talking about the drugs, we need to make sure that there is no over-the-counter drugs are taken, and drugs are only to be taken on the advice of a doctor, and so that it does not harm you adversely. So one need to keep your diet under control, especially those who are not yet on dialysis, lower protein intake, avoid or quit smoking completely, and maintain the regular weight and continue doing exercises. Thank you so much. And at the end, I again wish all those patients who have some form of kidney disease a very healthier lifestyle ahead, because developing kidney disease does not mean that it is end of life. A reasonably good quality of life can still be led. Thank you so much. Wish you all the best.